Hey guys, what is going on? Anthony here with Pistons Talk. I have a special guest today, Dr. Sonam, and we're going to be talking about Killian Hayes' right labrum tear. So we're going to get straight into it. So I know a lot of people, when they saw the injury, they thought it was a hip strain. And later we learned it was a labrum tear. Why don't you kind of tell the people what exactly a labrum tear is?
Yeah, of course. First off, thank you for having me on. And let's chat a little bit more about kind of what a labral tear is. I'm not sure if many of you have ever even heard of a labral issue in the hip, but essentially what the labrum is if anyone has heard about the meniscus of the knee, that's essentially a labrum to the hip. So it's a piece of cartilage and it lines the ball and socket joint. So if you think your pelvis is here, you have your femur bone here, and that's kind of your hip joint that gets to move nicely. The labrum sits in this ball and socket. It sits in the actual socket, and it provides stability and suction to the actual hip. Now, people may have heard of labral issues within the shoulder, which are more common. The labrum in the hip is actually much stronger because our hip is actually a suction joint. So we typically don't see injuries as much in athletes in the hip versus something like a labral issue in the shoulder, where it's just much less stable.
So I did have a question. So back when he was in Germany, he was only 186 pounds at 6'5". Since the pandemic and the NBA draft, as you know, because it got pushed back because of COVID, he's gained over 30 pounds. So he's 216 pounds. Do you believe him gaining all that weight could be the reason why the labrum tore?
How quickly did he gain the weight?
I would probably say maybe within a 2-month span.
Okay. To be honest, if you're looking at the mechanics of how he may have injured that labrum, unlikely. When we're thinking kind of like rapid weight gain, stress on joints, we're thinking more kind of degeneration. Our load-bearing joints are bearing more. But if you look at the replay footage that we reviewed, he kind of went into, like, he took a huge step. He went into extreme hip flexion. He fell on it. And my suspicions are the way he fell, essentially his hip kind of impinged itself and got stuck to one side. And likely, this is what I'm thinking happened, is that labrum got torn at that point. Now, the one thing I do want to keep in mind, I don't know if he's ever had any MRIs before, but if you actually image, say, 100 random people and their hips, about 20 to 30% of them will actually show labral tears, but not all of them are symptomatic. That's the other thing you want to consider as well. What type of tear it is? Has he ever had an MRI before? And like, is this a new tear, for example, or is this a flare-up of an old injury? So I'm not too sure about his medical history, but it's always something to consider, especially when you address imaging.
So, like we were talking earlier, and I told you that, you know, the MRI, you know, no vascular damage or structural damage. And a recent Yahoo Sports article said that he could be back within a 4 to 6 week time period because they want to do the rehab first to see maybe if he can rehab it, he could come back on the court within that time period. Do you think that's a possibility?
Yeah, so labral tears are treated very similarly depending on, even if you're an elite athlete. So take a varsity athlete or just an active kind of patient versus an NBA athlete, you approach them the same way. So a lot of labral tears, when you get them, you're going to want to rehab the hip quite well. Rehabilitating it, like regardless of if you're getting surgery or not, is absolutely necessary. And the reason why is surgeons want good range of motion. They want excellent core strength. They want good quad strength. They want excellent glute strength. So the external rotators of your hip, essentially. So think about your glute min, your glute med, all the stuff you do when you do a clamshell. So it's never a bad idea to do therapy. Now, when it comes to kind of the treatment of labral tears, there's your invasive treatment, which is surgery, and then there's your non-invasive treatment, which is your physiotherapy. Now, believe it or not, a good amount of labral tears will settle down with therapy. Does it mean that the actual tear is fixed? No. If anyone's ever blown their meniscus, almost half of them actually settle down with time. I've had one happen myself, and it just settles down. Nothing needs to be done. And unfortunately, the other half may actually need something to be done with it more surgically. Very similar to a labrum. So in Killian's case, if he's able to get back in 4 to 6 weeks and finish the season, he then has time kind of during the off season to maybe pursue the surgical option. So say if he really wants to finish the season, it responds well to physiotherapy in the 4 to 6 weeks. He has, minimal pain. He can really kind of compensate a little bit, and he's able to play on the court. That may be an option for him. Another thing I had mentioned as well was that in some cases, so as sports med doctors, we may inject a joint. We don't like to do it, but we may inject a joint to allow an athlete, for example, to finish the playoffs, to finish the season, depending on what the risks and benefits are. Totally an option in his case, because number one, you're going to want to do it to see whether or not it improves his symptoms. And number two, it could keep him playing until the end of the season. If he goes the surgical route, he can consider surgery now, but he's going to definitely be out for a good 6 to 12 months. And we could talk a little bit more about the outcomes of surgery afterwards. So he's got two decisions. Does he want to try physio, kind of get back in 4 to 6 weeks if he responds well and finishes the season, and then looks at surgery? Or does he want to go straight to surgery right now and miss the rest of the season?
Yeah, when I saw the 4 to 6 weeks, I was like, I want to be very precautious because they just drafted him. If he goes out there and re-injures it, re-aggravates it, then, he's going to have surgery. And he's going to be out, like you said, anywhere from 6 to 12 months, depending on how his body reacts. Because everyone's different. Yeah. I mean, you could bounce back really quickly. Yeah. But I think they'll probably do rehab, see what happens there, see if he has any improvements. If he doesn't, have the surgery, because that injury looked really painful. I mean, when I was watching the game live, I was like, man.
Really, eh? Yeah, I mean, yeah, when I saw that, you think a few things, right? When you see a guy go down like that, number one, males are much more common than females to pull their groin and to pull their flexor. So we're always thinking that. But it's actually pretty easy to discern whether or not they have actually intra-articular joint issues on your examination. So I was like, a sports medicine doctor, your physical examination actually tells you so much. And there's a lot of things you can pick up that can be confirmed by MRI. Now, he's an NBA player. So, I mean, if I was covering that game, for example, and I saw him go down like that and I felt that hip, he's got access to an MRI that night, I think, right? Was it that night he had it or the next morning? So he's pretty quick.
Yeah, like the next morning, I don't think we heard anything from it. Like the website I was on, they said bare minimum he's out until March 1st. Like bare minimum. And that's probably not including surgery. That's probably just including the rehab itself.
And to be honest, so the type of symptoms he may be experiencing, especially if you have a labral issue, you're thinking about instability of the joint, clicking and clunking. A few other things are deep groin pain, especially when you go into flexion of the hip. So think about a deep squat, so bum to ground. Mm-hmm. Anything that puts him in that compromised position and that really impinges that anterior part of his hip may cause him more discomfort. The other thing is if you think about how women sit and they cross their legs, that type of motion as well, bringing that hip inward, can also be uncomfortable. In some cases too, especially in patients with labral tears, there's a few types of labral tears you can get. One is a traumatic tear, which is likely what I think Killian has, just based on the fact that he had this huge step. He was down on the ground and there seemed to be a traumatic mechanism. But the other cause for labral tears that we see quite a lot, and I think some of the NBA players back in the past had it, was something called femoral acetabular impingement. Essentially what that is, fancy word, short from FAI, instead of a nice ball and socket, you have a square peg in a round hole. So they're not fitting together perfectly. And essentially what happens is if they're not fitting together perfectly, they can actually hit the sides of the socket, causing the cartilage to be damaged and predisposing you to having traumatic labral tears, but also degenerative labral tears. So I actually think one or two of the NBA athletes back in the past, I think it was prior to 2015, had that. I'm not sure if he does, to be honest. It seemed like it was very much a traumatic mechanism, but this could be another finding they may actually see on imaging.
So the one NBA player that comes to mind that's had this injury is Isaiah Thomas when he played for the Boston Celtics.
I'm wondering if it was him. You can't quote me on that right now. I'd have to look it up, but there's one that had the femoral acetabular impingement, so they fixed both together because they usually happen synonymously. Now, in Killian's case, the way he fell, I'd be more suspicious of just an isolated traumatic tear, but it's always something to consider, especially when you're looking at the imaging.
Yeah, so with Thomas, he really hasn't been the same player since he's had that injury. Is that a risk for him? Can he lose explosiveness from having the surgery?
That's a tricky one. It's a super tricky one because, as you alluded to, like, athletes are different. They respond differently. Bodies are different.
Mhm.
The surgery itself is actually, so like, I personally have had young varsity athletes, for example, get this surgery, and the outcomes, certain ones will wait until the end of the season and they're pretty much done playing their sport at high levels. Others are able to get back to it at high level. The surgery itself is pretty, it's non-invasive. So essentially it's arthroscopic. So a few cameras will go into the area of the hip joint. They actually can put quite a lot of force to distract the hip joint. So when you're when you're in the operating room, they actually put a boot on your foot and they apply pressure to help kind of distract the joint so they can get into the joint. And essentially they'll go and repair the labrum, and pretty much that's it. You can go home that day or the next day, depending on the surgeon's protocol. Each surgeon's a little bit different. And usually in terms of rehabilitation, they have a stepwise protocol. So, I mean, you go from kind of like limited weight bearing to then getting to weight bear a bit more. And believe it or not, they may not want you to do too much right away in terms of strength training and so forth, even though you have access to all this stuff being a professional athlete, because you really need the capsule to heal, the labrum to really kind of settle down after you've kind of sutured it in place or repaired it, however you do so. And then afterwards, kind of return to play, you're thinking 3 to 6 months. Could he come back completely like to his baseline? Yes. Could he come back a bit less than his baseline? It's definitely a possibility. And there's always the risk of complications, right? So, I mean, whenever a surgeon does surgery, when I do a procedure, you take people through the benefits and the risks, right? Here are the benefits of the procedure. We'll repair your labrum. Hopefully, for example, your pain will get better. We want you to get back. The risks are infection, for example, bleeding, damage to other structures. These are just very general, but things to consider. And unfortunately, some people will get complications with surgery. I'm not sure who will be consulted on his case, but usually athletes will go to kind of the kind of sports surgeon or sports orthopedic surgeon that specializes in that area. So they're in pretty good hands. But to be honest, the training is so long, most people are pretty good at managing these conditions, like surgeon-wise. They're in school for quite a long time.
Yeah, that was probably my biggest concern, because they just drafted him this year. That's supposed to be like a guy that's going to be a franchise player, and he gets injured less than 10 games into the season.
Yeah.
But that was one of my concerns, just like with him, because he's not really a fast player. He's patient. And I don't know if he can go any slower up the court now than he is. So that was just my main concern with that tear.
So believe it or not, for him, like with ACLs, for example, if someone blows their ACL and they come back, like it's huge for the stability of the knee, right? You're not pivoting, you're not cutting the same, or like you're just not trusting the graft as well. With the hip joint itself, it's a pretty strong suction mechanism that keeps it in place. So really what would be impacting him the most is really the pain at like very specific areas so usually it's really like deep flexion. If he's lunging, for example, if he's diving for a ball, if he's crossing over, it's going to be those things that are going to cause him issues, usually, like in a traditional labral tear. In terms of the explosiveness, I mean, he should be able to rehab a lot of the muscles afterwards to really kind of get back up there. Because it's not like the ACL of the knee; it's a bit different. Whether or not, though, he's able to trust it, and whether or not the repair is successful and pain-free, and he can kind of go through the range of motion. And most people post-operatively, they tend to do pretty well. Like, you're getting over 80-90%. And then when you think about athletes who are at an elite high level, such as like your NBA, NFL, and so forth, these guys have access to the best therapists, the best training, the best post-operative care. So it's even that much more, because their job is to essentially play, and that's all they're there for, right? Like, that is their career. So their motivations are higher. Their athletic endurance is just higher at baseline. Their muscles are better at baseline. They take care of their body. And there's also an argument to be said that, you don't become an elite athlete unless you have the anatomy that sustains kind of constant training and just like the wear and tear that you do it, but the body is just strong enough to endure it. So whether or not the outcomes may be better for him, it's a possibility. I can't say for sure, though.
Yeah, I mean, that's kind of given me a reassurance, because I'm like, just drafted the kid. He's not going to be the same player, because, like I said, I look at Isaiah Thomas. I think he did play on not a torn labrum, but just a really sore hip. And you can look at his career numbers in Boston, where he's averaging over 30 points a game. he's not even averaging 15. He's like around 12.
Yeah.
He's just not the same player. I don't know if he's scared to fall on that hip again because, you know, you go through that dramatic injury all through your head again. When you fall on it, you're like, crap, did I tear it again? But you have reassured me that, you know, he can come back. He's only 19 years old, which is a good sign.
He's young.
So young.
He's strong. Like, it's never for sure, right? I mean, there's always the instances where he may not come back, or mentally it's shaken him up enough that he just can't move past it, or the repair wasn't as successful. But I mean, there's a possibility, and they're quite successful. Like, it's not like for example, we were talking a little bit about a scope of a knee. It may be a little bit more tenuous as to who will respond, but these hip arthroscopies or arthroscopies, essentially surgeries, can be quite successful. And I mean, in a gentleman like Killian, he's got pretty much the entire team that you need, right, to really rehabilitate him. Now, I mean, the one reason, like, and we talked a little bit about the therapy itself, or the physiotherapy. If he responds well to that in 4 to 6 weeks, like, number one, you're going to need it anyway because the surgeon wants you to be strong preoperatively. The stronger you are preoperatively, the easier your recovery is afterwards. It is still hard, but we want people to be strong going into surgery, because then your muscle loss, your weakness, it's that much less, and it's easier to get back. But if he's able to play on it, for example, and he wants to finish the season, it's a reasonable option, and one his doctors may be talking to him about, but they're going to have to see how he responds in 4 to 6 weeks. And then afterwards, I mean, like, if you look at what Killian's options are, if he responds to therapy, great, he can play on a torn labrum, fine, if it doesn't impact him. But if it does impact him, he's got to think about, okay, do I want to play compromised? Do I want to play with pain? Or do I want to take the chance to make it better? And then most athletes who suffer traumatic torn labrums, almost all of them end up choosing a surgical fix, just because he's young. He's newly drafted. He's got a longer career in the NBA. So, I mean, this is not like an end of season career or end of career injury, right? He's just started. So he's going to want to try to optimize his recovery.
Yeah, I'm hopeful because he's so young, and, you know, he's not really reckless on his body. A lot of athletes are very reckless on their body, especially NBA players. I mean, I know you say you don't watch a lot of NBA players, but there's some NBA players that will go full force, just running against guys that are bigger than them, and just be completely just really, I don't know. I don't want to say stupid, but stupid. It's just like, man, you got to think. But
well, I'm going to think, like, when I think reckless on the body, right, I'm watching football, I'm watching UFC, and I'm like, oh, dear God, like, I feel for that. But definitely, like, I mean, time will tell in terms of how Killian's prognosis is going to progress. I think they really are waiting to see how he's going to respond to therapy. Whether or not they try an injection to kind of push him through it, it's available as an option. It wouldn't be a long-term solution. This would be I want to play, and if I can play through this, I'm going to. But it really is shared decision making, and that's kind of the cornerstone of a lot of what being a doctor is, right? You sit down with your athlete, you say, here are the risks to doing it. Can you play through it? Do you want to perform at a higher level? And we kind of go from there.
Yeah, we talked earlier, you know, before we went on about, you know, Blake Griffin and his arthroscopic surgery and his knee issues. I know I told you that his injury history is longer than my arm. The guy is just so injury prone. I mean, he didn't even play his rookie season because he was hurt.
How old is he now, by the way?
32 in March.
Okay, so see, that's the thing. He's starting to reach like peak. He's kind of past his peak years too, right? It definitely can be.
Yeah. So my question to you would be is, you know, he's had 2 arthroscopic surgeries on the same knee in less than 2 years. Is there a chance for him to get maybe more range of motion or more mobility into the knee? Because right now, the way he's playing, he just looks a step slow. He just looks like he's just not his old self that I was used to like 2 years ago.
So remind me, what did he get the surgery, like the arthroscopic surgery for? Because there's a few things to repair.
A torn meniscus that he was playing on.
Yeah. So in terms of range of motion, has anyone with his decreased range of motion, like, is it through assessment that you're realizing like he's got pretty limited range? Because usually when we see people postoperatively or after they have a meniscus injury, I lie them down and I really push that knee back to see how far it can go before it causes them pain. And that's when we kind of measure it for full flexion and then extension. What were you meaning by kind of decreased range of motion?
Like when he's trying to play defense, he he doesn't try because he probably knows his knee is like really, he's like on 2 surgeries in a year. So he really can't get back. He can barely jump. Like he's settling for jump shots because he doesn't want to go down in the post and potentially hurt it. It's just a combination of things where I'm looking at it. I'm like, yeah, he's not going to try to do anything. He doesn't want to hurt that knee again.
Yeah, and I mean, he said already 2 arthroscopic surgeries in the same knee. It could be a combination of things. I can't really speak to his range of motion because when we assess it, I'll get them down and I'll really push and crank it just to see what does it feel like. Is it a hard end point? How much can he get into extension? Because believe it or not, knee extension is super important. If you can't straighten out your knee, you actually can't do a lot of function. Particularly if it's walking, running, lunging, like it plays a huge role in it. And in terms of his flexion, I'd really want to crank it back to see is it a hard end point or not. Now, unfortunately, if he's had 2 surgeries to the knee and he's still not taking well, whether or not you may see an improvement in that, it could be that he's potentially leveling out. So, I mean, I don't want to say like whether or not, if an athlete's had 2 surgeries, you've noticed that their playing has kind of diminished. It could be that like Blake Griffin is essentially either just mentally not being able to trust the knee or the knee doesn't feel strong enough. A meniscus, I don't know if they repaired it or if they had to take it out. It depends on kind of what type of repair or what type of tear he had and what other things they found in the knee. They're tricky because if they're bad tears, they have to shave them out. If they're repairable, they will try to repair them.
So, I mean, there are highlights of him yimping up the court, playing on a torn meniscus because he was just so stubborn. They did inject him I know they inject him with, I don't know what the hell they did, but just so he could play. Yeah.
Yeah. So steroid if you want to play, but afterwards, like there are options such as PRP, visco supplementation, like hyaluronic acid. I know people have been floating around the idea of stem cells, although I work up in Canada and Health Canada's kind of taken that away because there's not really good research behind it. It's really the PRP that we try in a lot of our athletes and so forth. But there's multiple things you can inject in people. But if you want to get them back to playing, you're thinking steroid. Not ideal though, because you can steroid in a young person can lead to further cartilage degeneration if you repeat it too many times, and you just don't want to do that in a young 35-year-old player, for example, or 33 to get older.
Yeah. I mean, like I said, before he got injured, I mean, he had a lot of lift off his legs. He could dunk, really athletic for being a guy that was so injury prone. But this year, he's just, all his numbers are down, like averages. I mean, he's only averaging 13 points a game. When he was healthy, he was averaging close to 25. So, I mean, it's a huge dip. And he's probably one question mark every game. I was just like, it's only a matter of time before he gets injured again because.
Yeah, honestly, like once you have one injury to the knee, you're at risk of re-injuring it again, right? It's never as strong. Your meniscus is a big it's one of the stabilizing features of the knee. And it can cause quite a lot of discomfort if you blow your meniscus out, if you tear it. And it could be a combination of factors. He may just not feel strong enough. He may not feel that the repair was good enough. If you think about these athletes, they perform at 100%. Like pretty much like the big guys will perform at 100% when they're playing. And you know, if the repair and the injury brings them down to 95, you're going to see numbers change like that, right? Whereas in the general population, if you do these repairs, they may be okay because they're not pushing their body to the limit, whereas these guys do. So you will see these differences, unfortunately.
Yeah, I would probably say he's at 60%, if I'm being nice.
Yeah.
Like, I could show you the video where he re-injured it. It's really gruesome. Like, just limping up the court, having bandages wrapped all the way up to his thigh, probably like 10 ace bandages thick.
Really? The way you're describing it, I would have thought he blew his ACL because that's one that's never a fun one. It just you blow up, like your knee blows up like crazy.
Yeah.
Yeah.
I really don't have any more medical questions for you. You pretty much just hit the nail on the coffin. You reassured me with Killian Hayes. I'm not actually worried about it anymore. I'm actually more positive since talking to you and your medical, opinions on like what they could do, surgery, pre-surgery. Blake Griffin actually got more depressed.
He did.
I got
Yeah.
more.
Well, I thought you said he was more depressed. Oh man.
No, I'm more depressed after hearing that.
I mean, after a certain point, if you're rehabbing, it's been a year afterwards, for example, he's doing therapy. He's got an athletic trainer. He's training kind of 6 to 7 days a week, right? He's got optimal nutrition. He's got optimal rest periods. Like everything's to a T with these guys, right? When it comes to training, whether or not you really can expect more once you're 1 to 2 years out and you really try to maximize everything. It's I don't want to say yes, you can, because you may level off at that time, and it just, unfortunately, that's where he is. Killian Hayes is a bit of a different injury. These are all my personal opinions, and things can change depending on what they truly see and how Killian is doing and how he responds. But usually it's nice to know kind of what the course of this is like, because it's such a unique injury. A lot of people in the general population don't really know what it is, which I found, that's why I kind of decided to do a video on it, because I thought it'd be interesting to kind of teach people a little bit more on what it is.
Yeah, I think a lot of Pistons fans, they really enjoyed the video, and I enjoyed watching it because I got education over the injury. Like I mentioned, my family's pre-med, but I never went down that route, so I know a little bit, but not as much as someone like you would know, because you do it every day for a living. But I know you do have a YouTube channel. Why don't you tell my subscribers a little bit about what you do over there? And we're going to leave a link in the description. I want you guys to go subscribe to her channel. Very informative stuff about, maybe it's hockey, football, basketball with her injuries. So definitely go check out her channel in the description.
Thank you. Yeah, so I recently started a YouTube channel a few weeks ago. It was kind of a board-at-home pandemic project, aside from all the work I do as a resident trainee. And essentially, I wanted to kind of break down injuries and it's like sports injuries, whether it's Formula One. I'm a huge rock climber, so watch out for rock climbing content. Pretty much NBA, NFL, anything. And if anyone has any injuries they want to see and want to see covered, let me know. I'll do my best to cover them. I like to break it down, going through the video footage, but then also breaking it down into 3D anatomy. Kind of talk to you about what I'd think about when I'm on the field if I'm covering this, what the implications are, and what the return to play may look like. And I'm open to questions and comments down below in each of my videos. So if you ever have any questions, I'll do my best to answer them. And I like to say these are all my medical kind of opinions, and I don't really treat any of these teams, but this is what I'm training and doing, and this is what I'm really passionate about. So I decided I wanted to kind of teach people a little bit more outside of my day job.
Yeah, that's why I reached out to you. I saw just like the passion in your video. You can tell that you love what you do. And I think a lot of people are going to subscribe to the channel because, people don't have access to what the team doctors have. You can kind of, bring some insight of what to expect. But I want to thank you so much for joining me today. We've been on for over 30 minutes. Thank you.
Oh, wow.
For coming on. Shedding some light on the Killian injury, shedding some light on Blake Griffin's, meniscus tears over the past couple of years. We're going to wrap it up, you guys. Thank you so much for watching. Again, I'm going to leave her YouTube channel in the description below. I want you guys to go subscribe to that. That was the end of the interview with Dr. Sonam. I learned a lot about labrum tears, about meniscus tears, arthroscopic surgery. I hope you guys did enjoy it. If you guys are interested in subscribing into Dr. Sonam's channel, it should be somewhere here on the screen. You guys can check that out. But if you can't type or for whatever reason, her link will be down below in the description. You can check her out. I appreciate you guys taking time out of your day to watch my videos. It means a lot to me. I'm going to talk to you guys in the next one. Take care. Peace.